Hi everyone, and welcome back to my channel. This is Physio Sandy here. In the previous video, we learned about the bones of the upper limb. If you haven't watched it yet, I highly recommend checking it out first. Today, we are gonna continue with the bones of the lower limb. We'll explore how the lower limb is divided, learn the name of each bone, identify the most important anatomical landmarks, and discuss a few interesting clinical facts that every healthcare student or professional should know. If you have any questions during the video, feel free to leave them in the comments below. I'd be happy to answer them. Well, let's get started. Here we have the anatomical divisions of the human body. And as I mentioned before, today we are gonna focus on the bones of the lower limb. Well, we are gonna start with anatomical divisions of the lower limb. The lower limb is divided into four major regions: pelvic girdle, femur, leg, and foot. And in Spanish, cintura pélvica, fémur, pierna y pie. Okay, and we have pelvic girdle, cintura pélvica. This is the anterior view, and the pelvic girdle connects the lower limbs to the axial skeleton. It's formed by the fusion of three bones: ilium, ischium, and pubis. In Spanish, in order as I mentioned, ilion, ischion, y pubis. We'll move from proximal to distal, so the next bone we are gonna look at is the femur. The femur is the longest, strongest, and heaviest bone in the human body. En Spanish, el fémur es el hueso más largo, más fuerte y más pesado del cuerpo humano. Femoral neck fractures are common in older adults with osteoporosis. Next, we have the knee joint, and the bone itself is called the patella. Rótula in Spanish, rótula. La rótula es el hueso sesamoideo más grande del cuerpo. And the functions of the rótula or patella protects the knee joint, improves quadriceps efficiency, and increases the leverage of the quadriceps tendon. An interesting fact: the patellar dislocations usually occur laterally because the natural pull of the quadriceps muscle directs the patella slightly outward. If the ligaments that keep it in place are weak or injured, the patella can easily dislocate laterally. That's the reasons why. And now let's move on to the leg, which is made up of two bones: the tibia, the main weight-bearing bone, and the fibula. It's the lateral bone, bears very little weight, and stabilizes the ankle. And in Spanish are tibia and peroné. And we have something interesting that is foot drop. This occurs when the common fibular nerve is injured. This nerve controls the muscles responsible for lifting the front of the foot. So damage to it makes dorsiflexion difficult, causing the toes to drag while walking. And our last part is foot. In Spanish, pie. El pie contiene 26 huesos. You can see the names in English on the left side and the corresponding names in Spanish on the right side. In order, these are astrágalo, calcáneo, navicular, cuboides, cuneiforme medial, or in Spanish, you can say primera cuña, cuneiforme intermedio, or segunda cuña, cuneiforme lateral, or tercera cuña. The foot has 5 metatarsal bones. They are numbered from the first to the fifth metatarsal, starting on the medial side at the big toe and ending on the lateral side at the little toe. The foot contains 14 phalanges. Each toe has 3 phalanges: proximal, middle, and distal. The only exception is the great toe, or hallux, which only has 2 phalanges, proximal and distal. And before we finish, here we have a quick summary of everything we covered in this video. You can pause the video for as long as you need to review and go over the main points we discussed today. And that's it for today's lesson about the bones of the lower limb. I hope this video helped you understand the anatomy and briefly functions of each bone a little better. Remember that learning anatomy takes time and practice. So keep reviewing and don't be afraid to ask questions. If you have any questions, feel free to leave them in the comments below. And thank you so much for watching. If you found this video helpful, don't forget to like, subscribe, and share it with other students or healthcare professionals who might find it useful. See you in the next video, where we'll continue exploring the amazing world of human anatomy. Take care and bye-bye.